So, hello everyone. My name is Dr. Zack. I'm a psychologist. I started the Adult Attachment Program. Um, I'm also a Integrative Attachment Therapist. I went through the IAT training with Dr. David Elliott, and I went through the Adult Attachment Interview Training with House Steele. So that's kind of my orientation. I came to attachment through Dan Brown, and he sadly passed. Gosh, I guess it's been a couple of years now. Um, and luckily met David Elliott, who is Dan's co-author, and so that's my background. And I'm close with David now, and we're doing some work together, and that's nice. So anyways, this presentation is going to be looking at addiction as an attachment disorder. Um, it's currently looked at as a biological disorder brought on by your environment or not. Um, but we're going to talk more about attachment. And we will talk about some of the treatment as usual and compare it to what we are suggesting, and open to any feedback or questions. So we're going to start by talking about addiction just from an attachment lens. Um, we're going to continue by discussing the relationship between substance abuse and mental health, and talking about how we treat addiction as an attachment disorder, and there's research to show that that is effective. So whenever we're talking about attachment, it's important to mention John Bowlby. He was a researcher who was the first psychology researcher to talk about attachment, at least proximity to an attachment figure, um, and having an attuned attachment figure is just as important to a baby as food and water. If you put a baby in a room by itself, without an attachment figure, it's doesn't have any survival skills, yet. So attachment is an evolutionarily based need. Uh, so it explains why it has such a major impact on the system, changing the attachment, but we'll get to that. So Flores talks about how experiences of secure attachment, and I'll talk a little more about what that is, but they light up the same areas in the brain that drugs do, the pleasure system, dopamine system. Um, and there's an inverse relationship between addiction and healthy attachment. So we know that if you improve the attachment to a more secure style, that the chances of success in treatment are higher. In many cases, the substance was used as a social lubricant or replacement even for connection. People learn that connection is not safe. They're going to look elsewhere to get their needs met, to get their soothing. Um, People who have a hard time establishing emotionally regulating attachments in childhood are much more likely to substitute a vast array of obsessive compulsive behavior. And it really serves as a distraction from the internal discomfort and lack of emotion regulation skills. Most importantly, lack of co-regulation, because, like I said, as a as an infant, we don't have the most informed uh, regulation skills. So, we get that regulation through looking at mom or dad. We look at our caregiver and we see that they're comfortable and secure and confident and present. And that gives the child one feeling. And then if you look at the caregiver and you see someone who's anxious or feels uncertain about their ability to parent, they're going to feel another way. So, and without that co-regulation, it's just going to be looking from one obsessive behavior to the next. Um, Another one will take place when you remove the drugs and alcohol. The addiction will just You will find that the addiction will show up in other areas of your life if that underlying attachment isn't healed. This modality also looks at addiction as failures of the parent to accurately attune to and reflect the child's inner state, which leads to poor reflective functioning, which is a very common term in my part of the psychology world, and leaves the child vulnerable to addictive behavior in their search to finally be seen, confident, secure. So really seeing that addiction is just a misinformed attempt at self-repair, at um, trying to get that regulation, that co-regulation, but through a substance that's reliable and consistent. Um, and oftentimes that's the first time that clients have had that consistent soothing. And that can be very addicting. So, because it's so common to have mental health conditions, individual psychotherapy is great, but it's rarely used as the sole treatment. Um, and it points to the importance of community and multiple healthy attachments, not just to the therapist, not just to the girlfriend, multiple healthy attachments. So Kemker did a study in 93, and this is quoted from that. Attachment theory holds that the position that as long as the patient is using substances, the establishment of a working collaborative alliance will be difficult, if not impossible. And the very first pillar in the integrative attachment approach is helping them develop a collaborative mindset, developing a collaborative relationship with the patient. Because oftentimes people with insecure attachment have impairments in their ability to collaborate. And so the comprehensive treatment as usual for addiction, most of you know this probably, detox, group therapy, drug screening, meds, one-on-one therapy, family therapy, psychoeducation, neuropsych exams, and then the intro into 12 steps. That's pretty traditional what you get when you go to an IOP or a inpatient. So we use more of a relational model. It integrates the things that we know work based on um, established research, and um, until substance users develop the capacity for mutually satisfying relationships, they remain vulnerable to relapse and addiction. So that's a very interesting research finding. My little asterisk is pointing that out, but yeah, it's very interesting finding to that people who are able to develop mutually satisfying intimate relationships, that they are building protection against relapse. Um, so to really encourage people, even in the beginning, when they're the most afraid, I guess is the word, to get out there and to touch someone, feel part of something bigger than yourself. So they really must first detach from their drug of choice, from their old friends, and then develop the capacity for healthy interpersonal attachments. And my bias is that they learned that in IAT, I think. And how does one even develop healthy personal attachments? Well, it's through having a healthy internal working model, which was an idea that was, again, I think brought forward by Bowlby. But the internal working model is a representative model in the mind. Is the attachment figure likely to be responsive? Is the self a being towards whom anyone, caregivers included, would respond in a helpful way? Will my personal exploration be encouraged and supported? These are the things that one is learning when they're developing their internal working model, which they then take with them. The emotional availability, in other words, attunement of the caregiver, is a crucial factor in determining the makeup of the internal working model. In other words, it informs it very much. The emotional attunement being accurately reflected and seen by your caregivers. And so some of the implications, like substance abuse, is both a solution and a consequence of a person's impaired ability to develop healthy attachments, which makes an internal working model that just can't get your needs met relationally, but you can get your needs met with this drug or this substance, this gambling, whatever. Um, so the emotional availability of the caregiver is the crucial factor in determining the makeup of the internal working model. And this is a lot in 3 lines, but essentially, inconsistent caregiving, parents being around sometimes, but then not around other times, or available certain times and not available certain times. You see this a lot with alcoholic or drug addicted parents when they've kind of hit their sweet spot. They're really available and they're really great and attuned and present, and then when they're coming down, they're obviously not. So that creates a preoccupation from the child. The child becomes preoccupied with the outside environment. What do I need to do in order to get my needs met today? What do I need to do in order to keep my mom happy today? And it's an outside in orientation rather than mental health being really an inside out orientation or some balance in between. Um, on the other side of the spectrum, we have dismissing attachment, which is really from absent caregiving, dismissing or avoiding detachment. um, Child goes to mom and dad so many times and doesn't get their needs met, they just shut off the attachment system altogether in favor of the exploratory system, excuse me. So these are our CEOs and I have maybe politicians, I don't know, but um, people who have really learned to shut off their valuing of attachment. Um, and then if you have a harmful or scary caregiver, that creates disorganized attachment, or basically just not having a unifying theme, attachment style, but being able sometimes to feel to be preoccupied and then sometimes dismissing. So it kind of creates this push pull dynamic where the individual wants to be close, but when they do, it's scary, so they move away. So this is the great ambivalence, one of my teachers used to call it. Some of the general implications here, attachment is a fundamental motivation. It's more of a summary. The degree to which people can regulate their own emotions is determined by the length and strength of their attachment bond. And of course, we know that using drugs drinking is a way to regulate the emotions. So, but when parents or therapists use children or patients, clients, to meet their own unmet needs, that's when you create pathology in the other person. But earning secure attachment, on the other hand, produces alterations in the neurochemistry of the brain, which really alters behavior. In 12-step, they call it, a psychic change. That's basically what we're referring to here. So the long-term goals are to, of course, help the addicted person develop the capacity for mutuality and collaboration. Like I said, the first pillar of integrative attachment therapy, but helping them be more collaborative. And secure attachment, which breaks the cycle of alienation and separation, which they've no doubt been, experiencing. This modality views addiction as a problematic expression of the need for attachment. A good example, the AA meeting. You go into the AA meeting every Monday, and it's always there. You're seeing the same people. Are making coffee and doing the commitments, and it's a slowly a way to develop a secure base, which is what we're really looking for in attachment, is that secure base which we can return to, get our soothing, get our nurturing, get our resourcefulness, and then go out and explore. And so people with insecure attachment who end up addicted, who end up in treatment, they don't have the imagination doesn't even contain the possibility of that experience. So part of what we're doing in the imagery that we do in our attachment treatment is helping to remodel that and to give the imagination the experience of these certain qualities that we know create secure attachment. So, anyways, so co-regulation is another really important topic. Simultaneous mutual regulations. It's basically just being able to be soothed by an attachment figure, and it completely calms down the limbic system. The limbic system is the sympathetic nervous system, and emotion, all of that is there. And so calm that down, turn fight or flight off. There's plenty of room and space for development that otherwise it isn't. So this research showed that modulates, that we can modulate each other's emotions, neurophysiology, hormonal status, immune function, sleep rhythm, and overall stability. So co-regulation is a major topic in attachment. It's we learn if we can co-regulate, by the time we're two, because if our caregiver is a consistent place of attunement and stability and soothing, then that model is going to be in place. We'll be able to continue to receive that secure caregiving, and we'll also be able to provide it then to the next generation way down the road. So it is necessary to distinguish between healthy, secure mutuality and codependency or compulsive caretaking. So secure attachment is giving and taking. I take care of you, you take care of me. There's not an imbalance. So we talk about using relationship capital. You use relationship capital every time that you go out of your way to meet the need of your partner when it's not convenient to you, let's say. And if that capital isn't reimbursed and you just continue to give that capital, you end up broke, and we don't want that. So we teach people about this back and forth. I take care of you, you take care of me. So a new definition of addiction, that's very dramatic. I don't think I mean to be that dramatic. Is but in the Flores book, Addiction as an Attachment Disorder, talks about how addiction is the result of unmet developmental needs, which leave people with an injured, fragmented self. So when you have an injured, fragmented self, you don't have inner resources to draw upon. to regulate. And so you need outside sources, you need external sources. That's at least what you learn. So repair and restoration of the self, the internal working model, can be accomplished only within relationship. And this usually begins in therapy and extends out to other relationships. The patient needs a consistent, nurturing, mirroring, and holding environment that can contain and manage negative, destructive impulses. We're not trying to push those away. Oftentimes, they've developed their addiction because they weren't allowed to express emotion in the house. So, you know, we manage their they manage their negative, destructive impulses while giving them the chance to identify, internalize, and incorporate a healthy set of internal representations. So replacing the destructive impulses, the destructive images with healthy, secure images, or imagining those experiences. And then the body wants that healthy model. It doesn't want the old model. It wants the new model. It wants healthy. It wants safe. It wants attunement. So just some general remarks. Addiction is a disorder of the self, and mood regulation. I've said that a lot, but it's important to notice, that we're creatures who by nature are more driven and governed by our need for attachment than our need for instinctual pleasure and gratification. So he's saying that we are not driven by the need for power, like certain theories. We are not driven by, the need to feel sexually wanted by our mother, like some other theories. It's that we're driven and governed by our need for human attachment and comfort, and that consistent comfort. And so just as parental influences can dictate secure or insecure attachment patterns, the therapist can correct or perpetuate the troubled ways that patients relate to those around them. So a word of caution that you can collude if you have a preoccupied client who comes in and is just just fawning over you and telling you how great you are, and hey, we're humans, we like to feel good, we like to hear compliments, but that's something you don't want to collude with. That's not something you want to continue to allow to happen. At least it's something you want to bring attention to or help them bring their awareness to, because most likely they're not even aware that that's the effect they're having. So Hansen found that all substance abusers in the study, they were predisposed to abuse or had become dependent on a particular drug because they suffered from a particular type of dysregulation. So, for example, someone who identifies as not good enough feels they need to take an upper before going out, or someone who thinks they can't sleep without a sedative. So he developed this self-medication hypothesis, where users are trying to self-medicate, basically. And then there's a self-regulation hypothesis, where the child needs an empathic attunement from the parents in order to develop a cohesive sense of self. And this is Kohut he attributes the lack of empathy as a primary contributor to psychopathology, and that empathy is a tool that the therapist is consistently focused on. So just more evidence of the need for empathy, which means the need for others, which means the need for others who are attuned and hopefully secure. Affect regulation. Everyone, not just addicts, need people in their life that adequately mirror them and provide affect regulation. So certain people just suffer in that capacity. And these vulnerable people are more dependent on outside sources because they don't have the interpersonal skills to get the regulation that someone else might be able to through other people. So another way pathology forms. So secure attachment really creates a stable neuropsychological homeostasis. We try to replace that old internal working model with a new one. And with secure attachment, one is more able to regulate and soothe oneself. In the absence of a stable attachment figure, a person is more vulnerable to disruptions and relapse, hence the importance of a good therapist or sponsor in early recovery. So I've been talking a lot about integrative attachment therapy. What is that? Speak just a bit about that. So it started from Dan Brown and David Elliott. They have a book, Healing Attachment Disturbances in Adults, really seminal text in the field. And the beginning of the three pillars and ideal parent imagery. The three pillars are: one, enhancing collaborative functioning; two, enhancing metacognitive functioning; and three, restructuring that unhealthy and insecure internal working model into a healthy and secure one, using these ideal parent figures that are governed by these qualities that we know allow for secure attachment. So if you want to check out, we now have a website. I think there's 6 of us that are certified in America. I'm one of them. Check it out if you click on referrals after you go to that website. So attachment theory challenges the myth that humans can regulate their own emotions for an extended and sustainable period of time. We really rely on collaboration, that first pillar. Attachment cannot be reduced to a secondary drive. Humans are biologically wired to need people. Natural selection, Darwin, favored mechanisms that promoted parent-offspring proximity. So it's actually evolutionarily helpful, beneficial for the survival of the fittest, meaning he really thinks survival of the fittest is those who were most able to promote parent-offspring proximity, attachment, healthy attachment. Because of their ability to keep caregivers in close proximity during times of stress, human beings survived. So, addiction deals with core brainstem, and so does attachment. So it's a good, they line up quite well for treatment purposes. So the stronger the earlier attachment, the stronger the affect regulation. And strong early attachment experiences creates the internal working model that people can trust, that they'll be soothed one way or another. And then mental health attracts and promotes itself. The more people have it, the more they can acquire in their adult life. So, um, and we know that those who've had insecure attachments will be more vulnerable and more likely to turn to outside sources of regulation because their internal working model may be that they can't rely on getting their needs met, and or they have to throw a tantrum to be seen, or they have to hide because there's no point in expressing their self or emotion. So early treatment first requires that the person detach from their object of addiction. Since relationships can also be addictive, they must learn how to choose better lovers and friends. I put the 5 qualities we learn about in attachment that create secure attachment, which is safety, attunement, soothing, encouraging the strongest self, and expressing joy in the being of the self of the child. So those are the qualities that we as integrative attachment therapists try to uphold as well. And that's short term. And long term treatment requires that the patient's internal working model transforms, that the implicit rules that guide all of their intimate relationships. Therapy becomes a separate experience geared toward addressing the individual's developmental disturbance. So we're really looking to change that internal working model. It's like putting on a new pair of glasses. That Chuck Chamberlain, I think, wrote that book. He's a 12-step guy. And after stabilizing the user in early treatment, or helping stabilize the user in early treatment is the number one priority. Ensure that there's no seizures, tremors. Once patient is medically stable, then you begin the early stages of treatment and helping them sort of one day at a time, tackle sort of one thing at a time, not to become overwhelmed. But in order to really achieve that long-term sobriety, the old model needs to be replaced with a new and healthy one, based in the 5 qualities that I just talked about, and any positive opposite qualities of their caregivers that fail to meet their needs in some way. So the capacity for mutuality and conflict resolution is established. Mutuality, another word for, collaboration, is established. So in conclusion, I'm suggesting there's significant evidence to show that addiction can be conceptualized and treated as an attachment disorder. Addiction etiology from an attachment lens, that you can definitely see it as a misguided attempt at self-repair and self-soothing. They assume that they are not going to get that, and that internal model that says they're not going to get that makes them turn to the drug or the alcohol or whatever. It explains what 12-step programs work as that secure base. And we talked a little bit about creating a more relational model to treat addiction as an attachment disorder. which is a little bit of a different twist on how we've conceptualized it in the past. And in my experience, can be incredibly effective. Um, so if you have any questions, please feel free to email me directly. That's my email there. Um, this is our website. You could see all the wonderful things we have going on and coming up. Um, get on the mailing list. Hear about future webinars like this one. And again, if you have any questions about the material presented today, this is my email and the best way to get a hold of me, and I will get right back to you. If you're interested in the IAT training or looking for an IAT therapist near you, you can check out our website. And thank you guys very much for your time and kind attention. And please do not hesitate with the questions. I want to make myself available to anyone who has any questions, clarifications, or comments, wants more resources, whatever. Don't hesitate to reach out to me. It's my pleasure. So thank you again, and I hope everyone has a lovely remainder of the day.